They didn't measure like oxygen intake for some of our shepherds throughout science.
For each family, a little customized.
They keep it all their staff
for them to.
Right.
Based on what they said.
Yeah, they have a tour guide.
So yeah, we're trying it. But the professor used to say tell any of the other places about it until I'm actually interested in our chapter. And at the volunteer conference, I haven't asked talk with directors about Great Stride programs. And since we did that care center one that's not by national, the care corner one, that's now a national program. So what are you guys doing now? What's new? And I was like, we're not really ready to carry it.
Like I was talking to somebody else, she's gonna come back and she a girl.
Somebody else
I
said
can't
something.
even imagine like she was strong-headed before, like.
They then wanted to change the subject from this person. I was like, let's talk about something else. They're like, tell us about that new thing. And I was like, I wasn't going to talk about those. She said that we talked about the new thing. So now they're like, how's it going? And I was like, it didn't happen. So everyone's like, waiting to hear.
Well, it's still there.
Yeah.
Study abroad trip.
I think, I mean, I'm sure it's gonna be awesome. Like the families are super excited and like we're all super excited. But yeah, like I'm super nervous. It's the first time we're doing it.
Because
I wanted to be
back
awesome
down.
and I wanted to accomplish what, you know, our families
We're
wanted to
really
accomplish.
this year.
So she was there.
So I have so many goals for it. I think
Yeah, I'd like to say.
The altitude, the oxygen
So,
reviews and stuff.
there are some elementary
Beat that then.
At her
some
school, they have like an
middle
high school chamber, so she was able to couple of test herself. Yeah,
so we're trying to,
we're trying to do it in the chamber. And they're starting to survey, and I think they did research survey hours because that's
where the event was originally
and
supposed to take
so.
place.
So she knew that she could at least like do it, and it was a matter of, is she consistent with it? And they were going out, stay up
So
there.
yeah, so they're coming,
So
so.
she did great. So she got a little short of breath.
It was amazing, it's a whole new thing, so we're gonna try it.
But they anyway be hands supplementing for her lung function test.
Gavin's groupies.
Because anyway, the planning up and down.
I was gonna do just what you did for Down here, but I'm kind of
Mhm.
One way or the other.
Yeah.
6 months old first child.
Second
child.
Yeah.
9-year-old boy.
So you never, I mean, you really,
He didn't share any.
just never, and that's actually one of the points that I always make, is that
In India.
you talk to everybody, you get comfortable talking to
They
strangers.
don't do the worst screening.
Yeah.
And he didn't show any symptoms either. And until our girl, our daughter was born, we didn't even know that we were friends. We absolutely had even no clue about
Made
the
a
secondary
big cardboard display board that everybody that was in the restaurant.
Never heard of it
either.
And it was the same thing, it was on a newborn screen.
Right.
Are you reading the series? Yeah, I mean,
What is that cover?
I mean, we couldn't take them comfortable
3 hours.
for almost.
So she's, yeah, she's amazing. And she did her
Sometimes
first
if you start asking her
ambassador
now,
activity.
there's like
They
a
came
story
to
of
Rep.
at least our family of, you know, this can that, you know, she's
That
that's
was the first time she had ever
early
done
on as a baby, and that was what it was. But other than that, I was.
I was gonna say, she told me she was kind of.
So you never meet. In any of our relations, perhaps.
I really want to come to
Maybe you
this.
can never just in any of your like probably 6 or 7 generations. Right.
Yeah,
And it right. You've just gone a long time back on us. Right. That's very good attribute.
Well, you know.
Even our parents, even they cannot even completely comprehend what is.
So I love the article that
They are the opinions you try to do. No, we don't want to go towards.
It's really nice to have that understand concept. It's hard because it's not a visual.
Exactly.
What's wrong.
Yeah. There are the opinion that how could that be this is without medicine? I mean, that should just be medicine. Just give her that should be a cure for that. And that's the kind of sentiment you hear from people, like from common people who are not perhaps not even exposed or not even know such things exist in this world. Or this, oh, it's like you're kind of actually fine, right? They say that even there is even cure for cancers, right? It's supposed to be the most stressful and very bad.
Asian is the 10th that she graduates.
Common among the general public, and when we talk about something else which is in the gene level and
And
genetic.
Jay says whenever he finishes finance, so he finishes but we have dancers that are just saying.
Yeah, it's a lot to take it.
We were just talking about you.
Your ears ringing?
Not really, should have?
How are you? Here.
See you again.
I know, it's like.
Hi.
Hello.
I'm Raina.
Oh, yeah.
Nice to meet you. Hi.
Sorry, I have a fracture.
Oh, yeah.
Hi, doll.
I was just
so pretty. I mean, you know.
I was just telling Rebecca what a fantastic job you did the vacation night.
Oh,
Talking to
yeah, we were
strangers.
talking about it.
Talking to strangers.
I was telling you, wait, sorry. I
It's a
told
very important life
that-
skill,
yeah.
talking to strangers.
I'm
You
good
did
at it.
awesome.
You did awesome.
You know, I felt like I was
That was the rest.
escorted. I feel like
You
I'm
hang a
so
right
excited.
and then a left.
You know, he's chatting and then I'll see somebody, hi, who wants
I didn't get your name. Timothy. Those are nice. Sorry, I'm constantly fine.
Oh, that's all right. There's a lot.
It's tremendous fundraising.
It's hard to keep up with all these.
And your wife is Jennifer, right?
Yes.
Yeah, Tim and.
And of course, the girls were adorable. Really good.
Right.
Yes,
We
you
were,
did awesome. And you made that
You know,
beautiful display
I'll
board and that was
work
awesome.
Supporting everybody.
Expectations. Your expectations are always high, which is good.
but I'm glad we did.
You did awesome.
And we'll do it again next year and it's gonna get better.
Right.
And bigger and bigger and bigger. Yeah, the Gephards came
Oh.
because they eat there regularly and they saw the poster.
No.
So she got to meet them and
Over there.
to see Ash.
Probably some his company, isn't it?
You know what, I think I had you mixed that with,
So they very.
I did, I'm so. Oh, with her actually. Did I text you? Well, then
You were
you know,
supposed to
next
text
time
me to come babysit.
Yes, I know, and I never did. I have all the names, I'm serious.
To see like both of you, but.
Yeah, no, I did.
The
I
important thing
emailed
is that
it.
you had a successful event.
Yes.
I emailed her and like, there was my only thought, like, I'm hoping that she had more context than I.
I put it on my first.
Right,
Yeah,
yeah.
right. Okay.
Yes.
If she has a cute flyer, Sarah had done a bridal shower where it was a Mexican food theme and
Right.
they did, let's talk about love. And so for this one,
Massachusetts and changed that. It wasn't, the screening wasn't actually done in all 50 states, but Massachusetts was one of the
So
states.
it's
that
good.
we're bringing it out in. So
Yeah.
we came out caution, they should be doing it again.
Doing it again.
You know, maybe she doesn't.
So how are you? How was your day? I haven't seen you. Good work. Great job. We love it. And then since we got letting you out for Chapel Hill,
I know.
but we did invite everybody to kickball. So if anybody wants to. So everybody's out. Because all the food that was there was for
That's amazing.
That's
great.
But I'll send a reminder out tomorrow. We have kickoff meetings.
And there's someone else here that
Oh, perhaps I'm coming at that.
Part one of the other two.
Yeah.
So it took us 3.5 weeks to post it. Needless to say, we have not tried.
Other
now
which
it's- Kick CF out. They have a practice on their and so our team is actually ending up being called kicking grass. Because they have a 16-year-old boy on our
So
team
let's see.
and some other people who think like 16-year-old boys, and it's really hard time coming up with an appropriate. Because there's just too many really funny things you can say.
Not to say there aren't.
That have come to our meetings, I don't think so.
We don't.
My funny person.
What was it?
Indian or just right,
Yeah, we're getting close. So yeah, Saturday we were going to slash.
Okay. Yeah, Martha would know for sure.
That's what she told us when we met her
She
the
got
first
really
time.
funded as part of the term.
Right.
At least one or two.
Because a lot of the families have
I
expressed.
mean, it's kind of rare.
Yeah, if you have a
Yeah,
reservation.
It's in the
You have a reservation,
Right.
yes.
Yeah, that makes our dog extra special.
What is her name?
Arushi.
But yeah, so
Arushi.
so
That
8
means
families.
first place of the sun.
I saw it in her with the college.
Well, should we sit down?
So we have to come on and then went we'll see how long it is.
Oh, thanks, thank you.
That's what I asked, but I was always.
Which is, they should have had a volunteer from all states. So they wanted to do something before. And this was what they did. So each family can have a chance to ask.
I haven't asked.
Make it up. And share their.
I did. Very recently, last night.
So she's like, I'll do it.
I debated about going this weekend, and then I was like, you know what? I'll just-
Yeah.
There was nine. That's it. So we have.
You guys do anything for Memorial Day weekend?
We just
That was explained to me.
had some friends over on Friday, and then we just kind of hung out and did yard work. When we could, in the morning, yeah.
So yes, that's one thing.
Yeah.
Sunday. We were
It was. So we limited ourselves to, you know, early morning or late, or even late
No,
afternoon.
but even late was hot.
In fact, it might have even been worse.
Yeah, I mean, he just didn't even give up.
Yeah.
How about you guys?
Really good graduation on Sunday. Our family thing. Yeah. Friday was math for their school. Saturday we had a party at our house. And Sunday was actually graduation. And my family left on Monday morning, and I was just like, dead.
You guys have a lot of family?
No.
And are they in the area or no?
No. From New York. So my sister, her daughter came, and my niece. We're only given 6 tickets for graduation.
Right.
So we had like one extra.
Probably sold.
I know. I kept asking people, does anybody, usually they're hot.
Teresa was abroad in Scotland, so she's actually still there for another few days. She'll be back on Tuesday. And then Caroline will be back. Caroline will then graduate. Ceremony this weekend. She was taking some, because we homeschool, she was taking some classes for the school science and math, Caroline School Science and Math. And so they have a thing this weekend. And then the following weekend. And that's when we're going to have a little position too.
Oh, that's the baby next week.
And we do have some family coming in. It'll be fun.
You should. That's nice.
And they'll be coming, but they're not going to be at a hotel. Her parents will stay with us, and then my mom will stay with us. I think that's it. Although my mom is doing this weekend, she's staying for a few more days, and then she's gonna leave because we have a bunch of nieces and nephews who graduated this year as well, and they're down at Fort Mill, South Carolina. So she's going to their parties. Yeah, we're gonna head out west actually in June. We haven't done like the whole Grand Canyon and Zion and Bryce and all that, so we're doing that. That'll be fun. Yeah.
We were in Las Vegas.
I've
been once. Jen's never been. And the girls haven't been. Grand Canyon.
Security. I can't remember what rim we went to because it was. We were in the rim where they have the like this clear overlook thing.
Yeah. Okay. I don't think I'm gonna do that.
It was scary. I don't even like heights.
Yeah, I'm not a huge person. Yeah, I'm not sure what side that's on.
Yeah. We were like in a tour group. Some people did the helicopter tour.
Yeah, maybe
one of the guys had just like pictures. They land on the rim like.
Really?
Yeah. Wow.
That would be neat.
Go and start reading.
Jennifer, did you coordinate the trip?
We have. I'm not done coordinating it, but yeah, I did. Where we're staying. See how it's like.
Yeah.
And the rental car.
Yeah, we're pretty good.
I didn't know like Mike coordinates all our.
Oh, yeah.
Oh. Yeah, I do more of it. We talked about it. We're gonna have to go to Zion the first day. I don't think of that up this morning.
Yeah.
Bryce is farther.
But you're probably
We'll figure it out.
80%.
Nothing. And you don't hear like.
It would be.
Yeah.
Yeah, it's such a.
Perhaps
So busy.
that's fine. Yeah.
So we got the list for all of the pulmonologists in the UK, but I don't think days.
Right. We'll be there for
Yeah, if we're gonna do real travel.
Okay.
There's a microwave.
If we're going, we might as well try to.
So she's just taking the bag.
Yeah.
We're not.
Right.
At one point, I think when we first started looking at it, a few years ago, that was stuff like that. I didn't understand, like, you just don't. Yeah. If you want to
Yeah. It's there.
It's kind of narrow.
Yeah.
Places are like in Colorado, so we'll find everything else. This is drive up here. I'm like,
And your vacation's not turning into your vacation.
no, we're not doing that.
I got you, yeah.
That's good.
I should always take an extra.
And maybe just Jen and I will my sister.
You don't need to struggle to.
We can do it during the winter. They have some place to come.
Also,
Sounds fun.
she said it, for Bridger stuff.
A little bit. I wouldn't say it. Not like that. Certainly not like my nephew who lives up there. He's only 10.
And I do like occasionally.
Yeah, we're going to be
fun to do.
Okay.
I'm actually going to be in the Philippines too.
Okay.
Like Europe and
My knees can handle it.
yeah, England. Anyway,
So is this your first time?
but they'll be.
I don't think it's any minutes.
But I was gonna say, if she's not fine, like, that was the one thing. they said maybe it would be the day pass, if they were, they might not let you take them on the second leg. So that was the other reason we brought bags and then. Sure.
Start where I got it.
Yeah.
That was a lot.
There were a few people that were planning to call in.
Okay.
So cool.
So actually.
Okay.
So welcome, everyone. Thanks so much for coming. I'm so excited to introduce our speakers. We have two of our UNC postdoctoral fellows have joined, and this is Dr. Cupito, and this is Dr. Ashley Brown. And Dr. Allie is a pediatric psychologist with a special interest of with working with children with chronic illness and their families. She's Tar Heel, born and bred. Grew up in Greensboro, North Carolina, and attended UNC for undergrad. She completed her doctorate in clinical psychology at UNC Greensboro. She briefly went to the dark side, though I know we have some Duke families here today, for her pediatric psychology internship, and has now returned, she says, to the better shade of blue for her clinical psychology postdoctoral fellowship. She lives in Chapel Hill with her husband and 3-year-old son. She has a golden doodle puppy and is expecting a baby girl. And Allie's going to be working with some of our families, and she's going to talk about some of the programs that we're going to be offering soon. And welcome, Allie.
Thank you all so much for having me. I'm really excited to start working more with the CF clinic. So I am going to go over kind of mental health of caregivers in general, some of the new clinic practices that we're doing. The support group will be running this summer, talk about kind of some strategies for caregivers coping with everything that you do. And then I would love to hear from you all, kind of reflecting back on different stages of your children's lives, because I know that we have a variety of different ages of kids in this group. So that would be really helpful for us as we're preparing to do the support group for new parents. We'll talk more about that. So as you know, caring for a child with a chronic illness is very stressful. Parents get very focused on their child's health, and sometimes I think forget to take care of themselves. And this kind of, it can be more of this gradual buildup of anxiety and depressive symptoms, where you're going to get constantly think you're okay, and then all of a sudden it feels a little bit like too much. So there's been a lot of research on this, and parents of children with CF do have higher rates of depression and anxiety. And I think what's really remarkable, though, is that so many parents are so resilient with everything they have going on. When the depression and anxiety does come, it can interfere with parents' ability to take care of their child. So that's one of the reasons that's really important to kind of do self-care before it gets to the point of interfering with your functioning. So CF takes so much care by everyone in the family. It really is more of a family diagnosis, given that families have to aid children to do multiple health-related behaviors every day, in addition to kind of helping them with their normative developmental demands at different ages. So I know that the last presentation was on siblings, but I want to briefly kind of mention this, that it's really hard on siblings too. That some siblings kind of respond in really, really positive ways, with love, care, and support at certain times, and then at other times siblings can have more difficulties adjusting, miss their parents, miss their sibling, kind of only, depending on their age, only understand part of the situation. They might want to help, but not really sure how. And it's really normal for siblings to feel angry, jealous, left out, or guilty about their sibling's CF, but kind of not know it's okay for them to express that because they're not the one with CF. So I'm going to go through the different stages of having a child with CF. I'm going to talk most about the infancy period because that's what we're targeting in the clinic right now, but I will talk a little bit about what it's like at different stages for the whole family. So what the research shows is that most parents will say the diagnostic process is really emotionally challenging. To kind of not know at first what's going on and then actually to receive the diagnosis of this chronic progressive illness in your child with a lot of uncertainty of there's been a lot of recent medical advances and a lot of hope, but then there's a lot of variability in how kids will do. Interestingly, there has been research that parent distress is even worse when the medical team communicated the results of the screen in an impersonal fashion. So that's what we're trying to avoid at the CF clinic, is trying to kind of do this in a more personal way. So what we know from the research is that parents with an infant diagnosed with CF during that infancy period are at a much higher rate of depression. They experience higher rates of depression. So about 44% of mothers with an infant with CF met criteria for depression, compared to 35% of controls, and those were mothers with the same age child that did not have CF. And actually 33% of fathers with infants with CF were depressed, compared to about 17% of the control group. So we also know from the research that parent depression can have negative impacts on the child's health. Interestingly, though, with other populations that have depression, it leads to maladaptive attachments, but that was not seen at a higher rate with families with CF. So I think, again, that just shows the resiliency. Even though this is hard, it seems like parents are really there for their kids. So it can be hard to know when you have a newborn. Is this just baby blues that most moms experience? Is this depression? Is this grief related to finding out that my child has a chronic illness? So I'm going to spend a little time talking about the differences. So baby blues, most moms, up to 80%, will experience right after having a baby. It's typically within 4 to 5 days after the birth. It's thought to be caused by all the different changes in the hormones at that time, sleep disturbances, kind of the emotions from how the child is lived. It typically occurs kind of a few minutes per day to a few hours per day, but not most of the time. Most of the time, parents in this period are still feeling okay. It's just kind of, they have their moments where they're crying, they feel irritable, impatient, restless, really tired, of course, have difficulty sleeping on top of kind of the normal sleep services. So not only is the baby interrupting their sleep, then they're not able to fall asleep and maybe try to sleep. So the difference between this and postpartum depression is basically postpartum depression is more severe and it lasts longer. So these are individuals that feel sad nearly every day for most of the day. It typically begins kind of the first few weeks after baby is born and kind of lasts a couple weeks up to many months. So instead of just kind of having like periods of crying throughout the day, it's kind of more excessive crying and a really depressed mood that's more persistent, severe mood swings, feelings of hopelessness, worthlessness, and sometimes it comes along with thoughts of self-harm or kind of thoughts of harming the baby. It can also include suicidal thoughts. So it's just kind of more of a severe form of the baby blues. And now, when you have an infant that's not only not sleeping and have that big transition, and then you find out that your child has a chronic illness, of course, there's going to be some sadness related to that. So it's very kind of normal to experience grief when you find out your child is sick. About 70% of parents say the initial diagnosis is the most stressful time. Some symptoms related to the grief are shock, disbelief, denial, anger, feelings of guilt, decreased self-worth, lack of confidence. I think what's really hard with CF is the chronic uncertain nature. So that makes it hard to have that grief resolve, that it will pop up at different times throughout the child's life, depending on how many years. So common triggers for reemergence of the grief symptoms are kind of discovery of new medical problems, unending caregiving responsibilities, and the potential for complications and uncertainty of the child's future. So now we're moving out of the infancy and into the early childhood preschool period. So at this time, kids are kind of starting to speak, starting to think more critically about things, and really just beginning to learn emotional and behavioral regulation. So a lot of times, these preschool kids are very temperamental, normative for them to test limits. So this is a hard period in general, and it's that much harder when you are trying to make a child kind of comply with the CF related task. So some children can even exhibit extreme behavioral reactions in order to attempt to escape procedures. They might kind of show a strong aversion for medical events. In general, kids at this age with CF actually don't show higher rates of kind of emotional and behavioral problems than normal populations, but they do have more difficulties with sleeping and eating, which can be really hard for parents and the whole family. And then 40% of young kids have poor compliance with kind of airway clearance. So during this time, given everything going on with the child, there are kind of this can lead to marital strain and kind of less time at home for other fun activities for the whole family. And so even though the kids don't have more emotional and behavioral problems at this age, parents continue to have elevated depression, anxiety, and kind of just more stress in general. So during this phase, it's really important to prioritize self-care and all the limited time that parents have, kind of prioritize the marital relationship and kind of quality time spent with all children, because it can be hard when you're focusing on a child with a chronic illness to kind of also spend time with other children that are not ill. So during the school age, I think the biggest change here is that kids start comparing themselves to peers and start understanding that they're different because they have CF. And so that can be really hard for kids. And on top of kind of the daily activities, they can have, as you know, up to an hour per day completing treatments. So it gets even harder for them to fit this in. And at this age, at this age, the children with CF are at higher risk for psychological distress in general. There's limited research on how this stage impacts the family, but there is kind of recent study that showed parents also have elevated rates of anxiety and depression at this stage, and that what's associated with kind of better parent coping is not blaming themselves for things, kind of more active coping, parents who are able to have better social support, better family cohesion, and kind of maintain hope during this time. But then we get into the teenage years, which at this time peers become even more influential. Kids are spending more time with their peers and their family in most cases. They want that autonomy. And I think what's really hard is kids with CF are wanting that autonomy and not necessarily able to have it as much. They are more dependent on their parents still and spend more time with treatment-related, or so much time with treatment in general. And at this age is when they really might start understanding and having more fears about a shortened future. We also see that school-age kids are kind of the best in terms of adherence with treatment, and then when they get to adolescence, there's a sharp drop-off. And up to 50% of teens are kind of doing less than their prescribed treatment, and 30% of teens are actually not doing any treatments, according to this study, which is really concerning. Yeah. So it's a balance, because of course parents are wanting to foster that autonomy and still kind of needing to supervise, and a lot of times having a lot of conflict with their teen over these treatments. So the postdoc last year actually did some trainings. I don't know if anyone participated in the motivation, where they taught parents to do motivational interviewing in order to help their teens kind of be more motivated to take control of their treatment. So I think what's hard is at this age, it's common to say, oh, just let teens, teens be teens, learn from their mistakes. With CF, a mistake can be like threatening. So it's that much harder to kind of let go of some of the supervising. The other thing that has been successful at this stage, in addition to the motivational interviewing, is successive approximation. So that's basically where you give a teen one thing to do. Like they can, and then build from that once they kind of get used to doing that one thing. Give them a little bit more responsibility with their own treatment. All right. Now moving into what we're doing in the clinic. So we are, given that we know, especially in those first year after diagnosis, parents are at really high risk for depression, we're screening more for it. We're at that first visit, we are actually not giving a depression screening just because it's very normal to be very sad as you're finding out your child has CF. And so we're instead going to give a handout on the kind of the grief versus baby blues versus postpartum depression, have parents kind of think about it themselves, kind of talk about normal emotional responses, and then kind of that next follow-up, either month 2 or 3 of the child's life, kind of give the depression screening, and we'll refer parents with clinically significant depressive symptoms for treatment right away, so that hopefully getting parents into treatment quicker than they would have otherwise. And then at 6 months, we're going to kind of repeat that screening and refer. We are also starting a support group for parents. So this is for parents with an infant recently diagnosed with CF, and the infant needs to be less than 1 year of age. And we're going to do 4 weekly telehealth sessions. We're actually doing a mom's group and a dad's group. And the purpose of this is to connect with other parents going through the same thing, to learn some coping skills in dealing with all of this. And this kind of just tells you a little bit what we're going to do session by session. We're going to spend some time talking about uncertainty, guilt, and hope. So that's the plan. And at the end, I really would love your input in kind of things you wish you would have known. And we'll talk about that some, and we'll incorporate that into the group too. So now that we know that this is really hard, what can parents do to take care of themselves? So it's really simple things that can be really hard to do just when time is limited. There's so much focus on kind of caring for your child. And I got this off of the CF Foundation website, which had some really great resources for parents in general. But they kind of recommend to respond to bills, medication instructions, insurance forms as they arrive, to kind of prevent feeling like you're overwhelmed by needing to catch up on all of that, to learn as much about CF as you can. And I think I'm probably preaching to the choir here. All the parents that are here, I'm sure, are doing everything they can to learn about CF. Kind of make time for yourself and others who are important to you. And, again, basic things like make sure you're eating, make sure you're getting sleep each night, and kind of take a break each day, get outside, do something fun for yourself. Okay. Watch our video. I don't know how to get the sound on.
Chrissy just rescued.
Given to her, there was also a feeling of relief that we actually had a place. My name is Kat Quinn, and I have 2 children. My eldest is Maylee, and she has CF, and my youngest is Elsie, and she does not have CF. I had a very different experience than most families because Maylee was diagnosed at 3, and so those first 3 years of her life were very terrifying, trying to figure out what was wrong with her and not having answers. And so when Maylee was diagnosed, while cystic fibrosis was a terrifying label to be given to her, there was also a feeling of relief that we actually had a place to start working now. We had treatments, we had opportunities to help get her back to being healthy. The emotional aspect of CF is probably the most impactful aspect of everything. It's that feeling of being out of control, not being able to fix something. No one can go through what we go through every day, watching our children in pain or struggling to breathe or being the one to hold them down for a procedure and not feel some sort of anxiety and depression. There would just be nothing in you if you didn't feel that. And so it doesn't matter how amazing your support system is. It doesn't matter how amazing all the other moments in your life are. There are these key points within the CF life that absolutely rip you apart. With all the hurdles that we have, that if you're not healthy, you cannot take care of your children. And I think that needs to be the focus, is we are their role model for how they'll be caring for themselves. I think that mental health screening for both patients and caregivers should definitely be something that starts from the beginning. Having support systems in place that allow for caregivers to really unload about that feeling and have ideas as to how to kind of push through those times, right when those first clinic visits happen, that it's just implemented into part of the routine maintenance. I mean, how's your lung function? How's your BMI? How is your mental health as well as your child's? Just to kind of have that screening be a part of all the other screenings that happen, so that when a red flag comes up, it can be addressed in a very non-confrontational environment that makes everyone feel like it's just part of the care. I think normalizing the emotions that accompany the diagnosis and the disease progression is the first kind of point to get back to where I need to be the best caregiver for Maylee.
I think something else is playing. Yeah. Well, I'm curious kind of reactions to that video. How similar is that to your own experience?
I think she hit it right on when she said, at times you get ripped open. And I think as a mother, it's as what leads to depression and anxiety is depending on how fast you can fix that rip, because we all get ripped at some point. So I think that stood out the most to me, is that it all happens to us, right? So how do we fix it, and how do we fix it fast?
And do you mind sharing how you feel like you fix it when you feel like you're
If you want to know. So normally when I'm overwhelmed,
for years, I've dealt with it by, I usually go in the bathroom and take a really steaming hot bath and cry as hard as I can cry. Cause I feel like once I let it out, then I'm good. So that's how I've dealt with it. More recently, as my children are older, they're 21 and 24 years, not months. So more recently, I started going to therapy, and I wish I would have a long time ago. And I went mostly because for me, the anxiety got worse as they hit about 18 because I lost control. And so that's when I felt it the most. I'm sure I've had it the entire time, but that's when I noticed it the most.
For sharing that. I think that is wonderful what you're saying about just going to the bathroom and crying.
Yeah, but you just need your time to just let go. However you let go.
Well, and to kind of experience the emotion without trying to resist it, because of course they're going to be there.
Yeah.
Other reactions?
I mean, in my case, it'd probably be better if you ask him. To be honest with you, because I think I take it, I anger.
Yeah, for time to time, yeah, it can be just anger, but, going back to her, like, I don't know how I'm gonna react after we lose control when, they become teenager and not being around her 24/7, that's gonna be pretty tough.
I think what helped me was having my oldest daughter. She's not even a carrier. So for me, I had to fake it. She doesn't understand it.
Yeah.
She sees the whole therapy, the medicine, and she reminds me, so mommy, let's get up so you can I'm hungry, go ahead and get the therapy going, and so you can feed me, she's aware of all of it now, but I don't think she understands it, like the consequences, and she's now 2, Camila's now 2, so at the beginning she, why can we not take her home, when she was in the hospital for so long, and she would cry. But for me, I had to fake it. I don't know if I dealt with it. Look at me.
Still.
So yeah, to me, still very, a lot. But I have a 5-year-old. I had to fake it. Let's go play. It's great. It's beautiful outside. Let's go get rolling and go to the pool and and here, that she was born in the summer, so Mariana was like, let's take her to the pool, and I'm like, oh gosh, oh my God, what, I want to hide in around the rod. I couldn't. If I was gonna take a shower, I couldn't just stay in the shower because she was waiting for me, because he had to go back to work. Obviously, life goes on. So I don't think I had that. I was reading about grieving, and I don't think I had that chance, because I always, had my other one, and I'm a stay-at-home mom, so I always was with my oldest. So I don't think I ever had the chance to do anything. I just had to get up. It didn't matter how I felt.
And then it was tough. Obviously we can just even though we have a great support with somebody to take care of all this one, but it was from time to time that we just like, okay, we're gonna have to pick and choose tonight, and just gonna be with Mariana. We're not gonna go to the hospital, and it was pretty tough.
But it's still very hard, because your heart was, like you said, just ripped. And as much as support, and all the moms, oh, you can do it, we're here, yourself. But it wasn't enough. It was great, of course, and we're so freaking grateful, because we still do have an amazing support group. It just that thing inside, it doesn't go away. It just, look at me, it just doesn't go away.
2 years now.
Yeah.
All right.
Yeah, it just, every time I put her vest on and sit her in my lap and hug, it's in my mind. It doesn't go away. So I don't know if it will, but right now it's still very. It's very, very emotional, very, very hard. But I think that I have become that person that just fakes it, just let's do it. We and that's it. Because I know my friends are like, oh, you're great, let's go, baby. So happy all the time, and let's have a drink. So yeah, you do all of that, but yeah.
I think that's really common with caretakers because you're so focused on the caretaking that again you kind of forget about yourself. It's like you just gotta keep going.
That's just like all of it. Like I don't have time to think if I'm depressed. Like I don't get time to just I don't. I mean I really don't. If it's not dance class, it's feeding them and it's cooking, it's less therapy, it's medicine, okay, let's draw, okay, let's paint, let's go to the dollar store and buy some clothes. It is just, I don't have time until now that I'm like, you're reading and it's like, oh, holy, crap. I might be on number 2 right there, and it's just, sorry. But, it's just, you kind of like catch yourself like, huh. But that's why I tune into him because I think there's sometimes that he just not out of nowhere, like, what do you want? Just leave it, that kind of reaction that I do think I sometimes, or my oldest daughter, just, go and play, leave me alone, maybe I'm getting, which I wasn't. I don't think I was that, like, leave me alone, no.
And that sounds like grief too.
Yeah. And then I kind of catch myself, and then I cry, and then I go hug her, and and yeah, it's just.
So that leads in well to the next slide on when to get help. Like you're saying, that it's so easy to just kind of forget, just to keep going, to keep kind of pushing through. So times that we're recommending help is if the depression, sadness, or irritability starts feeling like you can't pull yourself out of it. Like it's taken up a lot of your time, kind of happening most days, more days than not, or kind of if the fears get excessive to a point where you're just like feeling paralyzed by this anxiety, worrying all the time, feeling like you're withdrawing, feeling like you can no longer fake it, honestly. Like just not able to move through it. If you notice any kind of big changes in your eating or sleeping habits, or kind of have really strong feelings of anger, kind of those are the times to get help. I think those are the times that we would say definitely get help. That being said, I don't think there's any harm in going to talk to someone, given everything that you are coping with, caring for your child's CF. And kind of some other just big ones are definitely if you're having suicidal thoughts or kind of any delusions or hallucinations, or just kind of having like a lot of headaches that like don't really have a cause, or kind of if you find yourself kind of coping by drinking or using other substances, then of course get help. But I think that what I hear a lot as a psychologist is that people wish they had come sooner for help. So I think if it's something you're considering, try it out. And it doesn't, another myth about it is like, oh, I'm going to start therapy and never end therapy. It's up to you. You can go 2 or 3 sessions. And even that can be helpful.
Can I say something?
Yes, please.
Okay. I just, because you mentioned that you don't have time to think about whether or not you're depressed because your children have needs. And sometimes they're very immediate needs and sometimes they're not as immediate, but it's always what you're having to focus on. So the time it takes to consider where you're at, where would one find such a thing? But part of, you talk about the self-care and doing these nice things and blah, 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 and that's all great. We want you to do that. But taking 2 minutes every day to do like an emotional check-in and think about, a couple times a day, where am I today? Am I sad? Am I mad? Am I anxious? Is it worse than yesterday? Is it better than yesterday? What happened today that's maybe making me feel this? And just be mindful and aware of where you're at. Because if so much time goes by and you're just like, doesn't matter what I feel, you gotta go, then you kind of, at some point, you may or may not, for everyone, you know, you might explode, or you might, I don't mean that literally. Obviously I don't mean that literally, but I don't mean like you're gonna yell and freak out, but you might get to a point where your emotions are no longer within your control, or the bath or the painting your nails or the whatever is not enough to help you feel better. So taking that time every day to just think about how you're doing. You do it while you're washing dishes. It just helps. It's mindfulness a little bit. What do you think about all this?
Yeah.
Do you agree? You disagree?
Yeah. So I think what's really hard is that kind of that pressure to go.
Yeah.
And so we'll do an exercise at the end where we talk more about how to slow down in the moment, even if it's 5 minutes, even if it's just kind of being more aware of your thoughts. So one of the things, the exercise that we'll pull from is coming out of acceptance and commitment therapy. And so there's actually been some research with teens with CF that acceptance and commitment therapy can help them cope with the fact that they have CF. So it's very different than like, you know, trying to change how they're thinking. It's just kind of like accepting that you have these strong emotions, accepting that you have these worries, and you don't need to fix them. You don't need to do anything about it. That's
because you're doing quite a lot. Everyone is, even with a lot of strong emotions, you're still functioning and doing great things.
I don't know how great of a function, but
I
try.
I think too, it's all of the bullet points on there. I think it's hard for you to self-identify that you're having all of that. And so now that I have been going to therapy, I suggest to everyone, if you have good insurance and it covers therapy, go for a check-in every 2 months, even if it's just to talk to someone, because getting that unbiased feedback where like you can vent about whatever you want, and they're not going to immediately tell you how to fix it. They're not going to be your mother saying, well, give them more pills or do this or do that. They're just there to listen. And so if you have insurance, it's just like going to the dentist. Just go. A little nicer. Sorry, that
So kind of tips to help the whole family with this is kind of just keeping everyday routines are really important. I think especially when things are tight, when things get thrown off, it can be even harder. So the more consistency in the schedule for everyone, the better. And kind of remembering to set limits as usual. When your child is sick, it can be easy to say like, oh, well, you know, I'm gonna let them have this because you know, they're not feeling well. And actually what's best for them is to have those limits. When kids don't have the limits, it can lead to extra anxiety because they feel like they have all these decisions, and that's actually not healthy, especially for young kids, to feel like they're kind of making decisions. So push against those limits, but actually the more you can enforce them is best for them. Encouraging children to share feelings, making sure you have that time with your other children. And as you mentioned, that can be really hard if you have a kid in the hospital. Don't leave the hospital to spend time with another kid, but that's really important to do. Kind of allowing kind of an age-appropriate way of participating in the siblings' care, and help them keep in touch with the child with CF when they're in the hospital. And then encouraging siblings to have fun, you know, telling them to not feel bad about going out and doing normal case stuff. Okay, so I actually need 2 volunteers for this next exercise. It's not gonna be hard. It's gonna be very hard.
Very hard.
It's not gonna be hard because it's tug of war and I actually forgot the rope. So you're gonna pretend to do tug of war. All right, thank you. Come on up. Step up here. I had my dog leash in my bag when I okay. All right. So one of you is gonna be the CF monster. Who wants to be the CF monster?
I'll try. All right, I'm really on the side of the
This is the CF monster. And this is the parent fighting with the CF monster. Okay, so this CF monster is a big, ugly, and very strong. And kind of here is this big bottomless pit in between the monster and the parent. So I want you guys to like pretend to play tug of war.
Okay.
It'd be easier if I actually had the rope.
What do we have? We
Okay.
should use.
Yeah.
Okay, so we're holding on to the rope.
Okay. And so, as a CF monster, what I'm gonna have you do is I'm gonna have you yell and explain using like thoughts about CF that you typically have.
I think that's fine. Give them the shorter one.
Yeah. Oh, we have an extra room.
Thank you. Okay, we won't really pull on it.
All right, yeah. Okay, so,
It's time to do your best.
Okay.
Do you want me to say like something like that? She doesn't
yeah,
wanna
no,
do
I'm
it?
supposed
You're
to
supposed
say.
speak.
She's the monster.
I'm
she's
supposed
the
to say.
She's
Things have been going a little too smoothly for you. So, I'm sending cold virus.
Oh, no.
And now you have terrible sinus pressure, congestion, and a headache.
Okay.
And,
Meaner.
and you have a test at school, and you don't
There you
want to
go.
miss, and you really wish you could be with your friends.
All right,
this
help
weekend.
out the CF monster. What else would the CF monster be saying?
You can't go to your cousin's birthday party.
Yeah, on top of that, and sorry, here's some steroids and some antibiotics. So, pack that up when you.
All right, now you're gonna keep going, and we're gonna actually have you just draw your room. Okay, so, the idea here is that the CF monster is still here, right on the other side of the pit. But it's just the idea of kind of letting go of some of this, knowing the monster's still there, but kind of just knowing that you're not gonna win that struggle.
You can't be pulled in anymore.
Right. What was it like to drop the rope?
Still here.
Yeah, it's okay. I mean, we've been doing that with our girls because they're older. So
Yeah.
dropped the rope. They're on their own a little bit. So it actually hasn't been, I don't know. I'm not sure. I mean, it's been okay, but I don't know. I'm just trying to think, why has it been okay? But it was, I guess it's hard because you have to manage all that and you can't fix it for someone. Right. So that's the hard thing.
Yeah. And it sounds like kind of you're at the stage where you're realizing you can't fix it. So you had to.
Right.
Yeah.
Right. Yeah. So, I don't know.
Yeah, and
If
the
that
reason
is
I was
helpful enough, I mean.
right, and I threw a cold, and because the thing is, once you get in a routine and you're coping, you're active, you're doing your life,
Right.
but it's all the unexpected stuff.
Right.
But
Right.
actually, you know to expect them, but they come up and just always
Right.
tugging at you,
Right.
Yeah.
So it's that stuff that's such a pain.
Right. Yeah, we didn't do a lot of long-term planning, or else we didn't tell our kids what was happening, so that they wouldn't be disappointed. I did a lot of that.
It's a great way to drop the rope, right? Yeah. We don't know what's gonna happen. Just accepting the uncertainty there.
Yeah, I was just thinking planning, like.
Or it's a coping mechanism.
No, I mean,
No,
well, it might have been,
Yeah.
whatever.
managing expectations a little bit.
Thank you to our volunteers. Yeah, for a second. All right. So, all right. It's important to know that there's a price with dropping the rope. and that kind of, again, you must accept that the monster is still there, kind of still lives on the other side of the moat, will taunt you from time to time, kind of unexpectedly, as you mentioned. But kind of as long as you drop the rope, the monster can't really cause any emotional harm, as long as you're not kind of still pulling and trying to fight against it. So also kind of mentioning that dropping the rope is a process and not doing the same thing, that you feel like sometimes it takes dropping the rope multiple times a day. And I think the key to this is to notice when you pick back up the rope or kind of fighting against that and kind of letting it go again. So that's the idea behind this acceptance and commitment therapy. It's just kind of letting it be there, knowing it's there. Other thoughts on it? It's pretty cheesy. So now moving on to kind of the reflection piece of all this. Thinking back to when you first found out your kid had it, what was that like?
I mean, we didn't even know such a dreadful disease even existed by then, and we had no clue that we were even carriers. And everything, it was like, everything was anew, everything was the entire, there was our world was completely different, and it was completely now transformed, and we just had a newborn, and she was found out of the newborn screen, so we're just stepping into that world of CF, and many times it is, when it was first disclosed to us, it was completely blind, we were completely blindfolded, and we couldn't even understand, we couldn't digest, we couldn't come to terms with it, and as you mentioned, right, it is stressful and
complete shock.
Yeah, it's complete shock and disbelief. Rather, no, it cannot be, that cannot happen to my child, and then of course, it was you go through a phase of crying bitter, that bitterness and trying, and like she mentioned, right, you try to fake it with with your friends, with your other peers, as if nothing has happened in your life, but you have to, the life just moves on, right? And then you come to a point where, and then once again, you start taking care of the child, and there are new things that you have never done in your life that you have to start doing. You'll have to learn new things that you've never learned so far, and you keep unearthing new things, learn new things, hope for the best. That's the most important thing that I found out, that hoping for the best, and something that I've convinced, perhaps it's too early in my life, but I always tell her that don't ever question why me, why us. It's just, it's nobody could have prevented it. It's just genetic, that's science. It's just biological, right? Yes, had we known earlier, perhaps we could have taken a decision, but now is that it's just too far in the process that you cannot undo something and go back in time.
Yeah.
Just you have to move on and just look at the universe, right? Just look at the broader perspective of things. In a larger perspective, the universe is so huge, and there are so many things like this in this universe that has happened over the billions of years. We are just not the only one.
Yeah.
We are not the only one or our kids are not the only one with such dreadful diseases. It has always been there. We have even seen them, right? We have seen people with cancers, dreadful diseases, AIDS. We have seen kids with cancer. We have seen so many things, but we just didn't associate ourselves with them. We didn't think that, this will one day, this may also happen to us. That realization was so important. And accepting that, yes, you are also one among this ecosystem. And we also see accidents, right? And accidents can happen to anybody. It's just like that. So accepting that reality was kind of an eye-opener, and which may keep you going for a while. Of course, and there's always a point when you start seeing your loved one suffering. There's always the thing that just pushes you back. But at least that's what I keep on telling her. Don't ask why me. that's perhaps we would never be able to get an answer for that question.
Exactly.
In this life, you may never get an answer. Why me? What next? Yes, we are also one among them. Now let's do the best that I know we can for that kid.
And that's a really good point, kind of about the why me, because I think that can very quickly lead into self-blame. Like, oh, I should have known. How could you didn't even know what it was. Like, how could you have possibly have known to kind of change anything? Or yeah, kind of a lot of times, what I'll hear kind of my patients say is when something happens, like they'll draw all these like really random conclusions, like, oh, it must have been this thing I did way back when. Especially with parents, like I had a parent this week, I forget even what she said. It was like her child was having attention problems, and she was like, well, when she was 3, I like did this one thing this one time. Was that it? And I was like, no, that's not it. This is not your fault. This is not your fault. It is what it is. And I mean, that's really sad and really hard. And I think probably the healthiest way. Okay. So I'm curious kind of how did you cope in kind of early months of your child's life?
I don't even remember. Like, I know your kids are in their 20s, but I mean, Angelica's 18. I'm like, that's all just a blur. I mean, you just do what you do. You know, it's like she was moving along.
I think trying
Throw
to
the vest on, do the
learn about it, yeah, and set up a routine, like you said, I think helped to kind of.
I mean, we had a different scenario because our oldest, they both have CF, but our oldest was born 8 weeks early due to placental abruption, and then my C-section, the wound opened, so I had to have it packed every day. So she was in the NICU, and so she wasn't. They were doing hadn't implemented the 50 states screening in the blood, but they were piloting it in Massachusetts, so it came back positive, but the doctor said, oh, it's probably false positive, but she was not growing, but she was also little, so there were so many things. So in a way, it was kind of,
we had a little bit more time.
It was a relief. We had more time. Well, we had all this problem solving.
Yeah.
Well, she was in the NICU before we even knew she had CF.
Yeah, but we did one night sit down and we were like, well, what happens if she does?
Right.
And we had a discussion about what if it does come back positive? Because they were waiting for her to be big enough to have the sweat test, and it took a long time before they were able to do
the first one, she didn't sweat enough.
Yeah, she didn't sweat enough. So, so that's, I think, gave us a little bit more time to sort of settle into it and think about that.
Right.
And then when they did tell us, I think they handled it pretty well.
They did. I remember. Who was in the room?
In general.
They did.
Yeah.
They said, it's a great time to be born with it. There's a lot of hope. The research advances, we're pretty good about it, I thought.
Personalized it.
I thought so.
I think the biggest thing when it's a baby is, so our son, the oldest, was born and we were at a non-CF center when he was born. And so the NICU doctor told us that he would probably live to be 14 but still make him go to school, I think is what he said to me. But anyhow, so 30 days later, we went to the CF center, and right after that, I think the biggest part was the nurse. I don't think I would have made it through the first year if it wasn't for the CF nurse, because she answered every question that I ever could have. And I think building that relationship is really important early on. And then the one thing I want to say about the learning piece, I think the CF Center or the CF Foundation should add to learn everything you can about CF from reliable resources. Because that was the best advice that she gave me on our first visit. She said, there's a lot of stuff out there. This was before social media. So she said, there's a lot of stuff out there. If you see something, you come and ask me first. And that was probably the best advice she ever gave me.
That is a good point, and especially with social media, because there's such variability in how kids and adults do with CF that kind of with everything, typically like the worst case scenarios that get a lot of attention, right? So it's really easy to kind of overemphasize those. So you all are already kind of jumping into this next question that I know you had time to think about in terms of kind of what support guidance was offered and kind of what you found most helpful. So it sounds like that nurse that kind of sat down with you and listened. And I know it seems like for you all, it was just kind of having hope expressed in that.
Well, I mean, we did learn a lot. We read a lot, and then there was the social. I don't know, we had good relationships with the nurse too. We built good communication, I guess, with our staff, with the CF team. That was important. And then the social worker, I don't know, maybe that was probably a couple of years into it, but there was a parent group like this, and so that's why we wanted to do that here, because we thought it was helpful, because we would bring in, they brought in speakers about different topics, and that helped us learn about, because you are in the daily grind, and there's all this stuff to do, and you don't really, now, we didn't have the internet then, or at least we didn't. But, so you couldn't learn, there was no way to be connected or even really learn except, that Orenstein book. So, I don't know, we thought it was good.
I think they were very well prepared and very well planned, during our first visit. It was just, we're fresh now. Just like this was January 22nd, I guess. December 22nd, 2018 is when we first stepped into UNC Children's Hospital and our pretty girl was just 15 days old, and they wanted to run some sweat tests, like the way you mentioned. She was just crying for like a couple of hours. She just couldn't sweat enough because she was so little puny. And but still, we just started with the enzymes, but the support structure, the kind of advice that was offered to us, the staff, the nurse, and everybody, and the social worker, that group, everybody were so supportive. They were so informative, and we were really, really, I would say it was kind of a mixed feeling of, mixed emotions that we were going through, and the kind of support that they gave us a lot of hope. So when we went back home, of course, fortunately, and we were blessed also to have our parents, back at our home here, and who were helping us in daily chores and also taking care of our elders. So that all these pushed us through the initial struggles, and I think we kind of came a long way. Still, I'm saying even in the 6 months, we feel that we've come a long way. I know that we have such a long journey to take, but.
So all about how you think about it, though, you have a great approach to just life in general, so I think that's amazing.
I think for me, it was the connection with a pulmonologist, but so my husband and I are both physicians, so when we got the diagnosis, all the horrible things came flooding in my mind. I knew what CF was. I've seen kids die. I saw kids with lung transplants. I knew all of the information. So for me, it was just like, But I think, I don't really remember that first visit with the CF team, but I think it was the pulmonologist, because he understood where we were coming from. And he was like, okay, just relax. This is what we need to do, and it's step by step, and it's gonna be okay. And I have twins. They're our first children. They both have CF, they're identical. And so for me, it was also realizing that I needed help at home, that, I couldn't stay home with infants with CF and do everything myself. So making that get off your high horse, you need help, right? You can't do it all yourself. So hiring someone part-time to help me out was really important too. But for us, I think it was really our pulmonologist, and we're still really like him, and just that connection with him.
I imagine that was really hard, kind of given that your position, you've seen all those worst case scenarios.
Identical twins for me.
And I do really appreciate what you said about accepting help. That can be really hard to say, one, say you need help, and then also to kind of let other people help when they offer available. Especially, with a sick kid, because it can be hard to, I think that's part of letting go of that rope, right? Especially when you have a certain way of doing the treatments with the kid, to let someone else do it.
Yeah.
So other kind of suggestions for the care team to support parents, or suggestions for us as we're starting these support groups with the families? What do you wish you had known at that time?
Well, the one other people have mentioned some of experiences I can reflect with, that were helpful. A great nurse at the center where we were in Atlanta. But there was also a pretty well-established parent group there, and we had topic speakers, and so we had that early on. And but as much as the speakers, you learn from the other parents who are a few steps ahead of you, and so that whole mentorship piece is a good one. And this foundation has a CF Connect now, on a whole national level where people are connecting by phone, but it was a call from someone local, like the nurse, I think, connected us informally, a parent. And, you don't even forget that first phone call with that CF parent. So, yeah.
And I bet it's really impactful to be a mentor too.
Right. Yeah, and the connection was we both had children diagnosed in utero, and so there's just some common bond that you can talk about, so.
Yeah, we try to, and thank so many of you who have offered to be parent mentors and have really, it's so amazing to have parents that we can refer people to, and that have, it's been great in this at different stages as well, and connecting, high school kids together that,
To me, it was very, I know, like when I first met Marla, all of them, everybody that we have become in touch with and that we have met through this, it's actually really great. As bad as it is, I was that this has put so many amazing people in my life that at the end of the day, I welcome it. But it was so hard for me to reach out. I couldn't do it. I think it took me, I know she was like, did you call? Here's the number. Please have your number. They're here to help. I don't know how many times she.
CF moms.
Yes, and I just couldn't do it.
But you
I just couldn't do it. But when they call me to speak to someone, it was easy for me. It was easy. Yes, so easy. And I think I don't know if you have her back or anything, but I hope I helped.
Hugely.
Yeah. But for me, I just couldn't do it. I don't know. It was just hard for me to, I don't know if for self-pity, I don't know. I can tell you, like, I'm going to start crying. I'm not going to get a word through. I'm like, yeah.
And what do you think? Because it's off, it's difficult, because we offer this, to families early on, and a lot of people, share that same reservation. It's just like, I'm not ready yet, or it seems too real. If I talk to somebody about.
For me, I think it's easier if you have people like that. Can you call them instead? Because for me,
that's a good.
For me, it was just hard to reach out. It was just hard for me to call in.
I think that dad called me. It's so clear to me, and it was so long ago.
Okay.
I think, and that was important.
Or maybe more people are comfortable by email. They don't want to talk.
Yeah, start by email.
Maybe start by. I never call. I called or texted you.
Yeah.
When we having that.
Why don't you talk about that though? Because that was
awesome.
An amazing thing that you started. That you may not think of it as part of this what we're talking about tonight, but that was your initial. You told you're telling the world and you're educating your support system. So talk about your decision to do that and how you set that up.
Well, that was actually me, Mom. No,
Word. That was his
And we would love to hear more about the dads, because we do feel that we don't focus enough on dads as well.
Yeah, so talk about when you decided to do that, because that was something you came up with.
Yeah,
was such a great idea, and it was yours.
It's just because, like he said, you don't know enough about CF. You don't see, what you see is AIDS, cancer, diabetes, Alzheimer's. you don't see nothing on TV about cystic fibrosis. Nothing. So yeah, I did make the mistake
There's a movie out now.
Well, you know, my mistake.
Yeah.
My mistake was going online
Yeah,
the first time they told me, you know. And of course, I mean, it was horrible. I mean, it was horrible. It was the biggest mistake. So he was like, get up and, don't read.
Is that how Felix talks?
Yeah, no, he'd be like, yeah.
Well, they say not to go to Google, so yeah, why don't you Google it?
Exactly. So, so then I went to my best friends, which are like the closest people I have, and it's, my best, it's just great support.
There was a lot of
group.
questions like,
What?
so
Why?
what is it? It's like,
what did you do? What do we need to do? How can we help you? What if you want to leave the kid? I don't leave my kids. I just now we started to come to this event and stuff, but I don't leave my kids. So like, what if we want to keep your kids? Like, girl, you're not gonna keep my kids. I don't keep my kids. But when time comes, you need to. I mean, yeah. So nobody knew about it. So I reached out to Marla to see, okay, what can we do? Can we do like a educational night? We'll bring wine, we'll appetizers, whatever. We'll kind of, and just talk. Tell us what exactly it is, where it comes from, what it is, what you do, blah, blah, blah. And I invited her. She came over as well, and the social worker from UNC and the therapist from UNC as well, Delia. And we just talked about it, and they explained what exactly was, what it did to the kid, where it came from, and all the good stuff. And family was there, my friends were there, and they learned. I mean, it was enlightening for everybody. And it made us feel really good, because people showed up.
Yeah, and especially just in case if we have to, emergency, you have to leave the girls with somebody. They know how to take care of them. They know what to do.
I mean, they did the therapy demonstration and all that stuff in case. They all know now how to give her, the medicine. Yeah.
That's very good.
Yeah, they all know how to feed her, the medicine and all that stuff. And we have to do a new one for the vest because now we got the vest.
She's getting used to it.
She's getting used to it. She still have to sit on my lap and kind of like, but she's taking it like a pro. Yeah, she's doing pretty good.
So now you've done more than probably any of us have done to educate our social networking group. You need to take time for yourself. You need to use it.
It's hard for me to leave. I don't. And it's me. I know. I do. And he says that like, what are you stressing about this? You cannot change it. You cannot do anything about it. Like I do. Like, what about tomorrow? What about next week? What about next month? Oh my God! I'm already.
So she's late. She's stressing because on Saturday is birthday party for Camila. So what are you stressing for? The birthday party? I was like, don't worry about that. It's gonna happen. You'll be okay.
I know. But yeah, I mean, it's that's what we did, and I think it turned out really nice, don't you think? Right?
I thought it was a terrific idea.
That's such a good idea.
Yeah. But everybody was, like, oh, this is great.
Yeah. I mean, as she gets older, like what I did was I went into charge of school from kindergarten through 8th grade. And educated the kids.
That's what we were talking about it. Like, I'm gonna have to go. Obviously, she doesn't. She's stays with me. But when we start, obviously, when she started like going, yeah, I would just think we were talking like I'm gonna have to go to her classroom and say you're gonna see her maybe taking a pill here and there. Or more than one, I don't know, but just because, but she's okay. She'll be, you'll be able to play with her. She'll be able to play with you and go here. I don't know. I guess that's right now what I'm thinking of. I don't know when I get.
Well, the kids are very receptive. I mean, I've had that with Angelica and with the schools that she was in. She was K through 8, so she pretty much stayed with all the kids. So they
you know, and then as she was getting older, when I'd ask questions, they knew all the answers. Like, it's kind of like, I'm like, oh, I can't get you guys on this. But I think it's really important. I mean, especially that you've educated your friends and family, like doing that when she started school.
Doing the same thing.
Yeah.
When did you do this education session, like at what age?
She was a baby. She was a few months
She was
old.
still,
She was a very few months old.
It
Right?
came from
It was very little.
a lot of questions, obviously, or
Even from us.
culture is
Right.
like, but she looks fine. What do you worry about?
Right.
No, it's like you were saying, exactly like, oh, just give her the syrup. She'll be
Yeah.
fine. Just, bring her over. We have a party.
Yeah, like, and it was hard because we say if somebody is sick in the house, we're not gonna go to see you, and they will take it personal.
Right.
Right.
Now,
Or
if
don't come
it
over.
come from me, yes, they probably take it personal because I don't never wanna go anywhere. But tell them that, like, or wait not to go to a party, it's for daughters. So but
He's a people person, can you tell?
so it was that. It was like if somebody's sick, we're not gonna be able to, and it was
But
like,
I think with
it's just
time they
because
got
you don't
better.
wanna come. Just tell us you won't come.
Yeah.
No, you don't understand.
Yeah.
They got better and said, listen, I just took, Sally to the doctor and she does have, I was like, all right, cool.
We won't be able to go. We just send the
Thanks for letting
person.
me
and-
know.
Right.
Even my
It was
friend, like,
more because
so
of
terrible,
that. Because
I'm not gonna come, or
they
you
didn't.
go, I won't come, I'm not gonna come, stay home. So when my friends were in it from the get-go,
Someday.
the family. Yeah.
That's my side.
And just remember, you will have built up her immune system, because you don't want to, like, that's what we were doing for Angelica as a baby, like sheltering her. We had a nanny.
I'm getting better. I'm getting better.
And I'm just saying, like, in
Yeah.
school, like, there's gonna be sick children.
Mm.
Like, Angelica's teachers are pretty good. Like, if she knew there was a kid that was sick, they'd move Angelica and stuff.
Okay.
But she's gonna get sick.
I know.
Yeah.
I try. I mean, I'm getting better of, playing the dirt a little bit. You know what I mean? Like, okay, go out without shoes. That's fine. And you,
Yeah,
I'm getting better.
she's messy though. She doesn't mind getting dirty, so it's new to us because Mariana, she can like her hands
Mariana.
dirty and then she won't want to touch it. Camila, on the other hand, she's put paint all over her face. It doesn't hit your seat, you're bad.
I'm always thinking like, it's just, oh my God, she's getting. I'm always. That's always on my mind.
She dropped something, pick it up, just see it's right.
One thing that intrigues me, or rather the question that comes to my mind is like, how does, from all your experiences, how did all your the network of people, the family and friends take it when they first heard it from you? Like, did they?
Pity. Oh,
Did
I'm
they,
so sorry.
Yeah.
Oh, like my kid's gonna die tomorrow. I was like, what are you sorry for? Well, it's a fatal disease. I'm like, yeah, so. I'm like, I could die tomorrow. So like, I had to like change those attitude of like, give me a break. Don't feel sorry for me. Let's try to embrace what my kid has, and let's work together and trying to find a cure for her. I mean, Marla with the CF Foundation, hooking up with the foundation, trying to raise money for a cure. I mean, the staff at UNC is unbelievable. And just, I was trying to look at the positive rather than the negative. I was just trying to change my family's attitude. And my mom was like, she might grow out of it. I was like,
exactly. That's what my father says.
Yeah, that's what my father says, yeah.
He says, she'll be fine. Don't worry. Yeah, she'll be fine.
yeah. Or like, you're
I wish that happens. All your words just come through and a miracle happens and just goes away from my daughter, right? That protein, that stupid protein, it just comes up fine. I'll be the happiest person. That's what
They're working on it.
I mean, do they? How did they respond to their kids in the sense, like, if you don't mind me asking, like, did they start restricting their kids to, be social with your kids, like, hey, don't go with that kid because
no. Because the other thing, like when I was talking about going into school, talking to the children, letting them know this is not contagious.
Right.
Like that was, the kids were like, will I get it? And I'm like, no. Now, you can't tell them it's genetic and then when they're in kindergarten. But you let them know, like, no, you cannot get this. You can play with her, you can touch her, it's okay. Like, but if you're coughing, don't get near my kid.
Exactly. Right. So that was the immediate ex-question, right? Because these kids are so vulnerable and susceptible to infections.
Yeah.
How could they be normal? This kind of false positive. We want them to be social, but on the other hand, not at there. Right? Be careful.
Right.
I mean, with toddlers and infants, it's so hard to. For both the other parents also, right? I mean, it's just all these common cold viruses are just everywhere.
Yeah. Yeah.
I mean, how did you all get through those tough phases in life?
I mean, you just do it.
We just try to make sure, she got cousins, they go out and play together, and they just like make it as normal as possible. She's gonna get sick, she's gonna get sick like any other child, but we just trying to make it look as normal as possible.
Yeah. Right now, what I have learned, because I was that paranoia mom, I was that.
What? Come on.
No, not Reina. You're looking at her too strong. But I think I have let go a whole lot. Right?
I saw her without shoes the other day.
Oh yeah,
I know.
She's like no shoes.
I had tried just because she's a very, very happy baby. Like she is happy. She goes to everybody. She waves and blow kisses. And I don't want to limit that. I don't want to take that away from her because she has CF.
Right.
Because I think I'm gonna regret it, and she's gonna resent me for it, or something. So I had to learn to let go and let her be Camila, not become CF. Camila's with CF, just Camila. And pray for the best. That I'm doing the right thing because she's a very happy baby. I mean, loving and bubbly, likes to get dirty and oh yeah. So I don't want to limit that. I don't want to take that away from her because I'm crazy. I do. I'm like, oh, guys, I'm crazy. I know this drives me nuts, but I just gotta let her go. Yeah, I gotta let her be.
Yeah, we've totally lived, traveled, all that stuff, but then you just, introduce some practical solutions.
Yeah.
Hand sanitizer in every pocket of the car. Hands, as they say, it's the only way is washing your hands.
I think I was driving Mariana crazy because he went to daycare and I would pick her up and I'd be like, okay, your hands, and it's just.
Yeah. Bathing with same hands, sanitizer.
It's just.
But she never got sick. Mariana.
So it's just, as normal as possible. Yeah. Because I don't want CF to become her. I want just Camila to be Camila.
Yeah, achieving that balance, I think it's an experience and a learning for every parent, I guess, the best thing that you want for your child.
Yeah.
Mm-hmm. So is this your first child?
Second.
How old is the oldest?
9.
He's
9 years old.
He's 9 years old, but we didn't see any symptoms. I don't think so. He's having any CF, but daughter was born and she was diagnosed through the newborn screening.
Newborn screening, okay. And she was born in December?
December.
December. Yeah. And what is her name?
Arushi.
I heard you say what that means. What does that mean?
Oh, that means the
first rays of the sun.
First rays of the sun.
Wow, that's pretty. So how is your family reacting?
So to be honest, we have only disclosed it to very close circle of relatives so far. It's when you say just the immediate family.
Yeah, my parents, his parents, and my brother.
Brother's family. Only these people know. Not every. We have not disclosed it to so many people.
So how your friends? They don't know.
Yeah, none of our friends know that.
Now why don't they know
even
that?
told our older son.
If not even disclosed this to our elder one yet.
Now why not?
Yeah, and that's where this is all the learning.
Okay.
We wanted to
Yeah.
We want to even learn how to do things.
I mean, I like, you know, when Raina brought in, you know, the CF Foundation, UNC,
That's very
to like,
That's very helpful.
I think, I mean, I didn't do it, but what a great idea, like, just to educate your family and your friends and be like, it's okay. Like, this is not a death sentence.
Right.
And that's how people have to look at it, and you don't want people pitting on you. Like, that's, my family drives me crazy.
I think that works well when you have family nearby. 'Cause
Yeah.
we didn't. I mean, and so it's hard to educate people when you have.
Yeah.
We actually found our friends to be more supportive than our family as far as.
Probably because they're
And
close
even
by.
still, well,
Same
even
here.
still though.
Oh, yeah, us
No,
too.
and even still, they won't tell us when they're sick.
Oh, yeah, well,
Or your
they
family.
just
Some
don't
of them.
ask. Like, I don't get a call that says, how's Camila doing, by the way?
Oh yeah, it's what it is. I mean, our friends are like.
Right.
Right now, I mean, one of my best friends is the one taking care of my daughters.
Mhm. So
Well,
it
in
depends.
terms of your.
Right.
Your friends might be, I'd be very supportive of it.
Yeah, I mean, so that was one thing that we, was also considering. Let's say probably, perhaps on her first birthday, I could probably arrange for a party and call, all these experts and give a small, and could just disclose to it.
The bombshell here.
You should do it before then.
Yeah.
There you go.
Yeah.
Well, you could do a great strides walk and kind of
Right.
break the news that way. But I think your 9-year-old, with young friends, when my daughter was preschooler and elementary, it's kind of a need to know basis. So even your son, your 9-year-old, start to know, well, your sister is having enzyme beef so that her tummy won't hurt her, so that she'll digest food. He doesn't need to know.
Yeah, those are the details that he knows.
He does.
Yeah, he does know that, we need to feed her, unless he sees that all the time.
Exactly.
And he knows that, she needs those enzymes.
He'll be a great help, honestly. He will, and when it's time to sit with the vest and the
Right.
nebulizer, he can keep
Maria,
her company,
yes.
and it's gonna be. he'll
Yeah,
be
in
a
fact,
great help.
Martha gave us a
reading
book
books at her, do
which
whatever.
actually
It
speaks
does
about what CF is all about, and I
Yeah.
think, he read it, and he doesn't know why he read it, why he was given the book. He just read it like any other book, any other comic book.
There's some good, the comic books, right?
Right.
The comics,
That's
are
really
good.
good. Yeah,
Right.
those are good.
Yeah, there's some other good
Hardcover, yeah,
Yeah,
more preschool. Yeah, we can.
medicated.
Yeah, the comics, yeah. There's some good comics.
I think too, the first year that really helped was when the nurse, again, she said that everything is not CF. Like, your child is a baby, he's crying, I called her one day because he was like, I couldn't get him to stop crying. I'm like, something's wrong, should I bring him in? I don't know what to do. And she's like, put him in his car seat and put him on the dryer and stand there with him. I'm like, what? I'm like, what are you talking about? And she's like, he's just a baby. He just needs to be soothed. And I'm like, oh, okay. So like, I think it's just kind of remembering that, like, while you're faced with this huge, horrible thing that you don't know anything about, that like your baby still is just a baby. Like, you still have the baby stuff to do.
Yeah, exactly.
Yeah, that's one of the things that we always ask ourselves. This is CF related. This is just
Yeah.
because it's a baby.
Yeah.
Like, who should we call?
My first goal was always like UNC, CF nurse, Martha. I mean, did you check get this? Like,
Any other kid?
oh, baby. And then I got embarrassed and we said like, thank you, go call.
They're always there for you.
Yeah, no, they're awesome. I mean, I'm telling you, I love UNC.
Yeah, they're great. They're really great at
They're
it.
great.
They're really
Yeah,
great.
our pulmonologist has been with Angelica since she was born. She's 18. She just graduated high school and he was at her party. Because it was like, he's part of our family.
Personal, exactly.
Yeah. I mean, our nurses were there, like,
Yeah, they do become your family. I just, our doctor in Cleveland is following me. Work is over, climbing the Himalayas, I'm checking in with him, I'm like, okay, she's okay today.
But yeah, see, she's climbing the Himalayas.
Yeah, we talked about it.
Yeah, and Angelica, we just saw a great article about Angelica, and her track, and so there's so much excitement.
Yeah.
Teresa's studying in Scotland.
Yeah, she's been studying abroad.
Yeah.
She comes back Tuesday.
Tuesday.
And we let our younger daughter go visit her, and she came back this evening. No,
Wow.
not. As a high school graduation. Yeah.
How fun is that?
I know. But, so I guess, I think it's going to be different though, because Teresa's going to be changing to the adult clinic. So there's going to be some of the anxiety because you don't have that relationship. But she'll have to do that herself. But that's okay. I mean, she had to do it in Scotland. So she had to go meet, and so she had to do all that. So it's practice.
Mm-hmm.
So I think that will be a little bit different.
I can now, when I'm in
the
that
rope.
way,
But
It is, and just like you were talking about how
Right.
that reemerged when they transitioned to adulthood.
right.
Yep.
See, they do their treatments, and they both do, but it'll be making sure they get good care.
And Teresa's come to
This is
clinic
a
quite
little
alone.
depressing, but
Right,
when we let go of the rope, unfortunately, our children are still holding the rope. Sorry, it's really a downer, but
Right.
they can travel
Yeah.
and they know how to take care of themselves.
It depends if you have a girl or a boy, but I still order my boy's prescriptions and he's 24. I'm like, you're gonna have to call a specialty pharmacy at some point. Or at least answer them when they call you.
Right.
Yeah. My father still does that to me. So it's like, it's kind of funny because whenever I go back to India, so we have this train system that takes you, from one city to other. Like the train will be at like 9 o'clock and he'll be like at 6:30, like in the evening. Oh, your train is at, it's like 2 or 3.5 hours away. And why do you do this to me now? I'm 27 now. I'm not 17.
You're always his child.
Yeah. They just see you as a child.
Yeah. Well, thanks, everybody. And please, more feedback ever for other topics or ideas and what you would like. The what? Yes, yeah, I will do, I'll send, I've sent a Survey Monkey, I think, to pretty much everybody. We're gonna be doing that again, except for.
Who don't answer it.
So thank you, everybody, for your feedback. That was really helpful.
And partly why we're doing it is because we did receive grant funding from the CF Foundation, and they want us to try to show a measure of learning or just, have some data, basically.
Yeah.
So one question I have is how should we get involved in this? What should we do? I mean, I don't even know how could we contribute or what kind of support or how do we involve
In what ways do you want to get,
every means possible, whether it's like, the physical support or any kind of, I do not know. I don't even know what should I even ask for.
Well, we will
We
talk.
are in the nascent stages.
Yes, and we have, parent mentors, we have a list that we can connect you with, and we can talk more in clinic. And Amy, the other social worker, I know she's been working with you all, but we'll make sure that we can, resources or support or, we're always available. We have psychologists, if parents are struggling and want resources, we do try to check in. I know that the CF Foundation, we had wanted to do more formal screening, offering that to parents. Unfortunately, we can't, the hospital doesn't let us do formal screening of parents. That's why we're kind of getting around that. We're able to do it within that postpartum period, but we're also, other ways of assessing and formally checking in, but knowing that even if we, people don't pop in or ask that, we are available in clinic and, you can talk to your doctor, talk to your nurse, reach out to your social workers. We're going to be working on some projects. We're collaborating. I've been in communication with the Charlotte social worker of doing new patient binders. We really want to, up how we are formalizing, kind of support resources. And so if anybody has some great ideas or have some great organization, we're going to be getting a parent group together. We have some samples. We're going to be working on a family day where we did a save the date. We're going to be doing a family day with Duke this year in September, which is going to be great. It's going to be an all-day event with lots of speakers. And so if you have ideas of speakers or topics that we're going to be starting planning probably this next month if you want to be involved in that. Jill and I were just talking about that. We're going to have one kind of in-group meeting just so we can start there, and then we'll have kind of a teleconference as we start planning. So there's a lot of things going on, and so reach out, and we'll reach out to you. And if you have suggestions or if you feel needs aren't being met, don't hesitate to let us know.
Perfect.
Thank you.
Okay. Thank you so much for coming, all of you, and being so open and sharing. And this was super helpful for me, and I hope it was helpful for you.
Thank you.
Thank you.
And I bet you're dying to go home and hug your daughter. Just got off the plane.
Our dog.
Oh, yeah.
He was pretty depressed.
Oh, I bet.
I think we'll have.
And thank you, Allie and Ashley, so much.
Very good.
Yeah.
Thank you. I actually have. So I just didn't know actually.
Yeah, we did. I know, she just wanted to. Yeah, that's fine. Yeah, so the other
Very
thing. Yeah, so we're, I think Ashley just wanted to.
Yeah.
So.
First meeting, yeah, I went to lunch.
Do we have people on the phone? We should ask them.
I kept checking, but.
I always remember.